Thank you, Chris. Good evening, everyone, and thank you for joining us tonight. I'm your Congressman Kevin Mullin, and I'm excited to be hosting tonight's live digital town hall, and it's an emergency one given the shutdown of the federal government and the healthcare crisis that is looming. I am honored to be joined by Jessica Altman, the executive director of Covered California, who's going to share her insights about how federal healthcare policies are going to impact us here at home in California and in the district. We'll also be answering questions from our live audience about the healthcare crisis that the majority Republican Party has caused. And then later, I'll be taking your questions about the broader impacts of the federal government shutdown. You can watch a live stream of tonight's event online at kevinmullin.house.gov/live. That's kevinmullin.house.gov/live. For our audience on the phone tonight, if you would like to ask a question, press *3 to get connected with our staff. Press *3 if you'd like to ask a question. Tonight marks exactly 1 week since the government shut down after House Republicans left Washington, D.C. My Democratic colleagues and I were in D.C. last week urging a bipartisan deal that would keep the government open and help ensure millions of Americans didn't lose access to their health care. Republicans control the House, they control the Senate, and we know they control the White House. Trump and the Republican Party chose to shut down the government instead of coming to the negotiating table. And if you know my history in Sacramento, I've always worked in a bipartisan way. And this is very clearly a result of the majority's actions. Unfortunately, they're focused more on tax breaks for wealthy billionaires and millionaires and corporations, having made extreme cuts to vital healthcare programs, including Medicaid and the Affordable Care Act. Earlier this year, I spent over 27 hours straight in an Energy and Commerce Committee hearing trying to stop the majority from cutting billions of dollars from Medicaid, or as we know it in California, Medi-Cal. Now they're trying to make healthcare even more costly by undermining the Affordable Care Act, which has sort of long been a priority. We know it as Obamacare or the ACA, the landmark federal legislation that ensured millions of Americans could afford healthcare. That's why I have been calling on Republicans to join Democrats in protecting the ACA and to prioritize the health of families across America. So up front here, before we bring Jessica in, we do have a poll question for our audience, and we'll pause just a few moments to get those results. So this is a poll question for our audience. Are you worried about your healthcare costs going up because of the Republicans' budget cuts? Are you worried about your healthcare costs going up because of Republicans' budget cuts? And you were to press 1 for yes, press 2 for no, or 3 if you're unsure. If you're listening in tonight, if you could press 1 for yes, 2 for no, or 3 if you are unsure. And we have the benefit of Chris, our moderator tonight, who is monitoring, in addition to moderating, he's also monitoring our poll results and helping us manage our programming this evening. So Chris, do we have just some early tabulations on that viewer and listener poll?
While I give it just a couple more seconds, I just want to remind everyone on this call that if you want to ask a question live, please press *3 on your telephone keypad right now. And if you want to sign up for the Congressman's newsletter, press *6. As for the results so far, again, the question was, are you worried about your health care costs going up because of Republicans' budget cuts? Right now, 83% of you say yes, 0% of you say no, and 17% of you say you're unsure.
Thank you so much, Chris. Clearly, there are great concerns about healthcare costs going up. I think some of that messaging is getting through that we need to act with some urgency to extend the tax credits that make healthcare affordable through the Affordable Care Act. So with that preface, I would like to welcome Jessica Altman, who has been serving as Executive Director of Covered California since 2022. California was the first state to establish a health benefit exchange thanks to the ACA. Prior to her current role, Jessica was Pennsylvania's insurance commissioner and helped establish its state based exchange. She also worked at the U.S. Department of Health and Human Services Center, where she developed policy and helped implement the ACA. She grew up in the Bay Area, earned a master's degree in public policy from Harvard. And Jessica, we are so lucky to have you back in California and helping lead California's healthcare efforts. And thank you so much for taking time out of your, I'm sure, increasingly busy schedule to be with us tonight. So, Jessica, before I formally welcome you, if I can, I want to make sure that our audience knows to ask a question, press *3 to get connected with our staff. Again, that is *3 to ask a question. We'll also be taking written questions from those who are watching online. And I serve on the House Energy and Commerce Committee, which has jurisdiction over healthcare, the healthcare sector, including the Affordable Care Act. American healthcare policy is extremely complex, and people's lives are literally on the line with the decisions made in Washington. So, Jessica, we want to welcome you to the program. And if you could just sort of define our terms here. What is Covered California? How do you implement the Affordable Care Act? So we're all on the same page to start our conversation.
Yeah, absolutely. And first and foremost, thank you so much for having me. Thank you for your efforts to fight for healthcare for your district, the Bay Area. I grew up just one district away in California, 16. So the Bay Area is very near and dear to my heart. So it's a privilege to be with all of you today. Covered California is the health insurance marketplace for the state of California. You know, most people in this country, they get their health insurance from their job, from their employer, or many who are old enough for Medicare or who meet the rules for Medicaid. But there are millions of people in this country and in the state of California who don't get any of those things. They simply are working but don't have the privilege of the type of work that comes with health insurance, with stable benefits, and with an employer that is going to pay a large portion of the cost of their health insurance. And so these people need a place to go. Covered California is where they go. We cover a record 2 million Californians coming off of last year's open enrollment period. California, under the ACA, has reduced our uninsured rate more than any other state in the nation. And what I know we're going to talk about more today is we're also the only place that you can go if you need to buy health insurance for yourself or your family, if you're self-employed, if you're in the gig economy, if you're working part-time, right? All of the people that look to Cover California, we offer tax credits that help to bring the cost of health insurance within reach for people. It is on a sliding scale, so the more you need, the more you get, depending on your income. But a very large portion of those tax credits is at risk due to expire at the end of the year unless Congress acts to extend them.
There absolutely should be a sense of urgency about this, Jessica. So just a quick audience reminder, I guess, again, *3 to ask a question. We'll also be taking written questions from those who are watching online. And just quickly, before we get into the meat of this, Jessica, we've been getting questions in my office. There's been a lot of misinformation coming about undocumented immigrants accessing federal health care dollars. And I just want to be completely clear that federal funding does not pay for health insurance for undocumented immigrants, period. I wanted to get that on the record. So, Jessica, before joining Covered California, you served with the U.S. Department of Health and Human Services, where you helped develop policy and facilitated the implementation of the Affordable Care Act. Can you tell us a little bit about how the ACA insured millions of Americans, how it allowed them to access that health care, and really what's at risk if we don't extend these tax credits? And I say we, there should be a bipartisan move on this well before the end of the year. But tell us what the implications could be if there isn't action.
Yeah, before the Affordable Care Act, I think a lot, but not that much time has gone by, and we often forget the way that our healthcare system really truly shut people out of coverage. If you didn't have a job that offered you health insurance, you weren't eligible for Medicare, even if you were working. You often, particularly if you had a pre-existing condition, were not eligible for any health insurance. And there were many people in this country who were desperate for any option that would offer them coverage at any price, not to mention that price being truly affordable. And so the Affordable Care Act really revolutionized the way our healthcare system works by closing those gaps and creating options for people who were previously shut out of the system entirely. We're going to cover everyone no matter what pre-existing conditions you have. We're going to let our lowest income residents, regardless of whether they have kids or are pregnant, access the Medicaid program, and California expanded Medicaid from the beginning. But we're also going to recognize that people from all walks of life, middle income people who are hardworking but don't have employer coverage, deserve a place to go. And that's why we created the marketplaces under the Affordable Care Act. That's why California launched Covered California. That's why across the Medicaid expansion and Covered California and these enhanced tax credits that I'll get into in a minute, California reduced our uninsured rate from over 17% to just over 6%, the largest drop of any state in the nation. Now, during the pandemic, Congress and President Biden said, coverage is critical. Now is not the time that we can have people who can't afford health insurance. And they recognized that as much progress as the ACA made, there were still people that found marketplace coverage unaffordable. And so they enhanced the tax credits, made them much more generous, both giving the lowest income people we cover more tax credit than they used to be eligible for, and opening up eligibility to middle income Americans for the very first time. As a result, marketplace enrollment doubled nationally, more than doubled from around 11 million to 24 million people. We hit record highs here in California. And so to just put a point to it, these enhancements were not just about giving more support, they were about giving people coverage that they could afford who could not afford it before and bringing more people into our system, and they have been critical in doing so. So if these enhanced tax credits expire, the reverse is going to happen. You have a bunch of people, hundreds of thousands in California, who are middle income will lose their tax credits altogether. And then you have our lowest income enrollees just above that Medicaid eligibility, Medi-Cal here in California, making something like $23,000 a year, will get a lot less tax credit. The end result, what Covered California enrollees will pay is due to increase on average by 97%, effectively doubling. And that is actually even higher in California District 15 with an average 114% increase in monthly costs for Californians. And we know that is going to price some people out of coverage. We estimate as many as 400,000 Californians will be priced out of coverage and leave Covered California if these enhancements are not made.
Yeah, Jessica, I've been getting lots of calls from constituents who are understandably scared of what will happen if they can no longer afford health insurance. Experts are saying that due to healthcare cuts, including the devastating cuts to Medicaid, 15 million people are expected to lose coverage. This includes 2.4 million people in California, 28,000 people just in my congressional district alone. Some families are facing really insanely steep cost increases, as you referenced. For example, a 60-year-old couple who earns about $82,000 a year is facing their annual costs going up $29,000. That is a 600% increase in their healthcare costs. So, Jessica, what have you been hearing from people who are trying to figure out what all of this means? These folks who get their coverage through Covered California, and just give us, if we aren't to act on this and these credits were to expire, what other byproducts are we going to see in the healthcare delivery system? There'll be individuals, if they really lose access, you're talking about emergency room visits and all sorts of other impacts that will be very damaging to the overall health of Californians. And just kind of paint that picture for us if there isn't action.
Yeah, I mean, healthcare is so personal, and people are really nervous and want to understand what these policies, including the enhanced tax credits, but the Medicaid cuts, healthcare changes across the board, mean for them and their own family. But I think we also all care about our neighbors and the woman who cuts our hair and the man who picked us up from the airport in our rideshare this morning, right? We want our community to be covered, and I think people recognize that as at risk. If you are covered on Cover California, right, like I talked about before, we are expecting people to say, you know what, I can't afford this anymore and walk away. And that means that their health, their family's health, if they disenroll their whole family, is at risk. Their financial security is at risk because if something happens and they need healthcare anyway, they're going to be on the hook for that bill. But also, our healthcare system is on the hook there because they are going to end up in emergency rooms, not all of them, but some of them, and they won't be able to pay those astronomical bills. And our system will have to find another way to pay for that. I also think a lot about the fact that there are many people that cannot afford to not be covered. That whatever the price increase because they have a cancer diagnosis or a chronic condition or they're pregnant, keeping their health care is the most important thing for them. And at a time where so many other costs like food and transportation and childcare and these things that we need in our lives are stressed at an all-time level, right? This is simply the last thing that people need in order to figure out how to just balance their proverbial checkbooks. We don't really do checkbooks anymore. And these are real kitchen table issues. But to your point, they also have these systemic issues. Many people listening today may not be on Cover California. They might be in the future because by the nature of Cover California, whether you retire early or start your own business, 1 in 6 Californians have needed us at some point. So this is also about who will need us in the future. But this is going to hit our healthcare providers, right? When you talk about millions across the marketplace on Cover California and Medicaid going uninsured, healthcare providers are going to be fighting to survive, particularly our safety net providers. They're going to need to increase their revenue in some way, and they're going to be looking to other sources of coverage, whether that's employer coverage or other places, to find ways to increase their revenue simply to survive and to keep offering the services and making available the same providers they have today. And some of them will be able to do that and some of them won't. So again, whether you're on Cover California, in which case, please be looking out. We're going to be communicating with you very actively so that you understand your personal circumstance, how this impacts you, sort of moving past the averages that we're sharing today. But also know if you're not a Cover California enrollee, one day you might be, but also this is going to matter for you and our healthcare system and our communities regardless.
So again, *3 if you have a question for Jessica. And Jessica, we're hearing from some in the majority party that, look, we've got time here. The credits don't expire until the end of the year. But the reality is, notices, I believe, are already going out to individuals. The open enrollment period is coming up. There really is a time crunch. There isn't, I would argue, that sense of urgency that we need to reopen the government, get a bipartisan deal, extend these tax credits. In my way of thinking, it should be done indefinitely to eliminate some of the uncertainty there. But just talk about how we really don't have all the time in the world here to figure this out. We've got to act now, given the nature of the healthcare system and the way it works and how people make decisions, financial decisions for their lives. Why we need to take action ASAP.
Yeah, you're exactly right about that. I mean, we are talking about health insurance coverage that begins on January 1st, but most of you listening know people need to make decisions before that. And whether you get coverage from your job or on Cover California, there's an open enrollment period. And that is the time when people are paying attention. They're seeing the prices, they're making choices. They're saying, I can afford this or I can't. I can keep the plan that I have, or I need to choose a less expensive one with a much higher deductible, or whatever those decisions are. Open enrollment begins on November 1st. That is just over 3 weeks from today when people are going to start shopping. And Congressman, as you said, many people are already getting notices. We're putting ours in the mail on October 15th to 2 million people to tell them what their costs, what their families' costs are going to be next year. And so even if Congress does extend these tax credits, but they wait until December, we will have lost people from that sticker shock, from that fear, from that loss of trust of our healthcare system and our programs, who said, I can't do this anymore. It's too expensive. They're sort of playing games with my healthcare with these last minute changes and all of those things. And as hard as we will try at Cover California, and we will try as hard as we can to reach people to get them back, we will have lost people. in the process simply because Congress didn't act on time. And so I cannot stress enough, we delayed our notices normally go out on October 1st to October 15th to try and hope. We have two versions. There's one we'd much rather send, I can tell you that, and give Congress time to act. But there's only so long that we can wait when we have to open our doors for open enrollment on November 1st.
So, Jessica, if you could hang with us for a few more minutes, we do have some questions from my constituents, people who are concerned about what they are hearing on healthcare. Chris, our moderator, Chris, do we have folks on the line that we can plug in and have Jessica address their question?
We sure do, Congressman. And before we do, if you're just joining us and you would like to ask a question, please press *3 on your telephone keypad right now. Our first caller is Mary, and Mary is calling from San Carlos. Mary, you are on live. What's your question?
Hi, I'm just wondering what does the impact might be for those who are not on covered California and are not receiving government subsidies. Are the premiums going to increase across the board for everyone, regardless of whether or not they get government subsidies?
Thank you, Mary, for
Jessica,
that question.
Broad impacts, even if you're not directly affected by covered California. Do you want to talk about that the potential for that at least?
Yeah, absolutely. And right, so we're talking about something very urgent in this moment for millions of Californians that rely on covered California. But I talked a little bit earlier about how these things and how these cuts have ripple effects into our healthcare more broadly. We're already seeing premium increases across all sectors if you get coverage through your job, rising more than they have in years. And these things are contributing to that, and they will continue to contribute over the coming years as we see the Medicaid cuts come into effect, as we see these and other changes to cover California coming into effect. And so, like I said before, right, when healthcare providers lose patients that have insurance coverage and they see more patients that are uninsured and they don't, frankly, usually have revenue coming in for those patients, they need to look for it somewhere else, or they need to make changes to their business model. I would expect to see providers potentially even having to close because they can't make it, particularly in rural areas. See providers say, we're going to have to let go some of the doctors that you may rely on, or we're going to stay open, but we have to close down maternity care or other critical services because we can't meet our bottom line if we keep them open. And those changes affect everybody who uses those providers. So I think that's one thing to be thinking about from an access perspective. But the other is that will then carry over to premiums elsewhere when providers say, hey, insurance coverage provided by employers, I'm losing lots of money in these other ways. I really need more of an increase than I've had because of that, and to make that up. And that will, maybe not all at once, an 114% increase, but it will impact our system and impact others and impact those that get coverage. And by the way, everyone in some way relies on government subsidy for their healthcare. If you're getting your coverage from your job, it's tax deductible, both what you pay and what your employer pays. And so it really is, in some way, everyone is getting support from the federal government, except potentially if these enhanced tax credits expired, middle income enrollees that rely on covered California.
Important note there, Jessica. Thank you for that. So we have more callers with healthcare questions for Jessica. Let's go to another caller, Chris.
Great. Next up, we have Bernice on the line. Bernice is calling from Portola. Bernice, you are on live. What's on your mind?
Yes, I am presently a recipient of Medicare, and I just wanted to know if down the line that we're going to have any issues. So I haven't heard anything yet, but just Medicaid, but not Medicare.
So the question is about potential Medicare impacts. We know during this government shutdown, CMS Medicare is operating. My staff here is available in my district office to address any constituent questions specific to Medicare. But Jessica, you follow this healthcare space. What are you hearing about any potential impacts to the Medicare population? Much of the focus with the Republican budget bill was cuts to Medicaid, many of which will not really take hold until after the next election to sort of blunt the political impact. But those cuts are looming. And in some cases, there are districts with my Republican colleagues where 40 over sometimes close to 50% of the population are Medicaid eligible. 1 in 4 births, I believe, in California are Medicaid births. So enormous potential looming impacts with the Medicaid cuts. But on Medicare, making that distinction, Jessica, are you hearing anything that our constituents ought to be aware of?
Yeah, and we really love our confusing terms in healthcare. So Medicare, our program in this country that predominantly serves our older residents, 65 and older. There are that I'm aware of, and I'm far from a Medicare expert specifically, but no sort of direct changes, direct cuts, direct price hikes when it comes to the Medicare program from the actions that have happened in Washington. And I know we have a lot of members of Congress that will certainly stand up if those discussions ever come. What I would still say, though, is everyone, I think, needs to be thinking about some of these indirect impacts that are going to be coming as these cuts to other programs take effect over the years. For example, maybe you rely on a healthcare provider that's going to be impacted and have to change how they operate or change their providers, physicians that are there, and those types of things. So I think it's important that all of us be vigilant about how these impacts are going to take hold in our communities, but there is not a direct sort of immediate impact to the structure or affordability for those that rely on the Medicare program.
Great. So Jessica, just want to do a time check with you. Do you have just a few more minutes for a couple more questions? I know I want to be respectful of your time here.
Anything for the Bay Area, Congressman. I'm here.
Thank you for that. So Chris, let's bring in our next caller, and we'll get toward a lightning round here and get as many of these in the minutes that we have here.
Great. And real quickly, I want to remind people that if you want to ask a question, press *3. And I'd like to encourage everyone on this call to sign up for the Congressman's e-newsletter. You can do that right now by pressing *6. Our next caller is Rochelle from Burlingame. Rochelle, you are on live. What's your question?
Oh, okay. Can you hear me?
Yes, we can.
Yes, we can.
Okay.
Yes, we can.
Well, I think based upon what you've been talking about, it's going to affect me greatly. So my question is, I don't really have a question. I just have a statement. Self-employed people not old enough for, Medicare when you turn 65.
Yeah.
So the premiums already are very, very high, and to have to pay the whole amount myself would be, I don't even know how I would do it. So I agree with what you were talking about earlier.
Thank you for that. And as somebody who was formerly self-employed myself, there's a big segment of the working population that are self-employed that don't sort of automatically access healthcare through their employer. And Covered California is a tremendous option for folks if they are eligible. But Jessica, do you want to just touch on that impact potentially on the self-employed?
Yeah, I think what I would say is national data shows 48% of marketplace enrollees are small business owners, sole proprietors, and employees of small businesses. And so this is about economic opportunity, right? Our small businesses, our sole proprietors deserve to have healthcare just like everybody else. But I hear all the time from marketplace enrollees who say, I could only start my small business. I could only make this choice. I could only move to part-time so I could care for an aging parent or a young child because I knew I would have affordable healthcare on Covered California. And so it's very near and dear to me that for many Californians, yes, this is about their healthcare, but it's also about these broader choices that they make and will make in their life about how they can choose to work, how they can choose to support themselves and still have healthcare that every person deserves.
Great. And Chris, next caller, if you can.
Great. Next up, we have Ann on the line. Ann is calling from Millbrae. Ann, you are on live. What's on your mind?
Hi. Thank you, Congressman. I'm an injured worker, and for 5 years, I had no insurance at all. And you live in fear of a car accident or cancer. Thankfully, when Covered California came on, I had insurance. Now I'm retired. My premium's going up 20%. So I I want both of you to keep on fighting and fighting for people who need Medi-Cal on that and Covered California. And hopefully, at this point, push it to include dental, because that's how we keep our bodies healthy on that. But thank you. Again, Covered California, you were there when I needed you.
Thank you, Ann. Always good to hear from you. Thank you for that comment. And let's go just one more caller if we can, and then we'll let Jessica get on with her evening. Chris, let's bring in one more caller.
Our next question is an online question, Congressman. It comes from Patricia, who's watching right now. Patricia says, will the healthcare crisis affect people age 65 and over?
So, Jessica, again, this is for the most part the Medicare population. But again, you could be talking about sort of the byproducts of the changes that are sort of looming with Medicaid, but also certainly if we don't take action in urgent fashion here with Obamacare, ACA tax credits.
Exactly right, Congressman.
And since that was such a short one, I'm going to take one more and see if we can get a question for you, and then Jessica gets to move on. So, Chris, who do we have on the line?
You've got it. Next up, we have Billy Sue in San Mateo. Billy Sue, you are on live. What's your question?
Thank you. Kevin, last week I heard on MSNBC that the Democratic Party that went to have a conversation with the president felt that the president did not really understand the impact totally of what was going on with the health care increases or cuts. And I'm wondering if you know of some Republican that the president really respects and the Democrats that the president really respects that could set an appointment and thoroughly go over with the president the exact impact on what is happening, because I don't think he understands it. I don't think he's getting the picture from his supporters. Thank you.
Thank you for that. And I think what I'm going to do is I've got some opinions on that. I think what I'm going to do is let Jessica go, and I'll address that question. Jessica Altman, Director of Covered California, thank you so much for taking the time. More importantly, thank you for what you do every day to keep California healthy. And we will do whatever we can to get a deal in Washington, and hopefully there'll be no disruption in how you operate with Covered California. But thank you so much for taking the time, Jessica. We do appreciate it.
Yeah, and thank you so much for having me. And thank you to all that asked really important questions. And just, if you're on this call, I know that you care. So thank you for your time. And thank you again, Congressman. It was wonderful. Wonderful to be with all of you. Thanks.
Excellent. Thank you so much, Jessica. And with that, I will address that question. You know, ultimately, this shutdown will end with a bipartisan deal that is negotiated in good faith with both parties. Now, let me reiterate, the Republicans have the majority in the House, the majority in the Senate. Of course, President Trump occupies the Oval Office. The Republicans are set agenda right now. I hope that will change in the coming, and we can bring some balance of power, a check on President Trump's authoritarian style governs. But until then, we want to have a seat at the table. And I think it's fair to say Democrats aren't going to support something unless the dramatic healthcare cuts are largely rescinded. And more importantly, in the immediate, that the Affordable Care Act tax credits are renewed. And we hope that is an open-ended conversation with regard to tax credit extension. But in terms of the question, who does the president listen to? I think your guess is as good as mine. I would not be shocked if the president doesn't know the details of the Affordable Care Act, other than it was created under Obama with the incredible leadership of Nancy Pelosi. So he's opposed. And it's been a longstanding Republican policy priority to undermine the Affordable Care Act, given that it was a chief domestic policy win for President Obama. and it has brought healthcare access to millions. Now, I would say just from practical politics, if you look at polling, people are deeply concerned that the Republican majority is going to let these tax credits lapse, which would be devastating for household budgets at a time when affordability is a serious challenge for people across this country, with housing costs and childcare costs and utility costs going up, with the economic uncertainty of tariffs and all that this president has brought in terms of disruption and dysfunction. So there is a great concern out there. And I think my Republican colleagues can read a poll as well as we can. I think they're going to feel an urgency to act on this, but it requires negotiating in good faith. And my Democratic colleagues and I were in Washington last week, ready to have a discussion. I think much of the core discussion will probably happen in the Senate, where I think you're going to see points of a deal eventually come together. But there's no doubt that there's great concern that this could linger for weeks potentially. I visited the air traffic controllers at SFO, which is right in the heart of my district. We have a host of federal employees who have been furloughed, who are continuing their essential work, but aren't going to get paid until a bipartisan agreement comes together. So we need our Republican colleagues to come to the table and negotiate in good faith, extend the ACA tax credits, and move on with the business of governing. So with that, I certainly appreciate that call. I'm sorry we couldn't get to all of the healthcare questions that were in the queue. We're trying to capture as much as we can and make sure that we get as many questions answered as we can. But Chris, let me go back to you. If we have additional callers who are concerned about the government shutdown, and we'll try to answer as many questions as we can. And my trusty communications director just held up a sign that says "Announce the poll." So we did get those initial results, Chris. Do we have any updated results? I think, there's a second poll. We have a second poll, Chris. I will find that. In the meantime, do we have final results from that first poll? And then I'll rifle through my papers to try to find the second poll that has been created for me. So, Chris, let me toss it to you.
Yes, the results of the first poll were 83%. Are worried 83%. About your healthcare costs going up. 83% are worried.
So, in the meantime. Yeah, we're gonna find that second poll question. But in the meantime, Chris, if you could bring another caller in, I would like to address their questions.
You got it. Here's our next caller. It's Lauren, who's calling from Foster City. Lauren, you are on live. What's your question?
Hi. For folks watching who might not know, during this government shutdown, federal employees across the country in D.C. have been furloughed or working without pay. That includes people like my sister, who works for WIC in Long Beach, California, helping families feed their children, and my partner, who works for Voice of America, which actually went completely off the air on October 1st, something that's never happened before, even in past shutdowns. There's a lot of confusion right now because the White House Budget Office is saying furloughed workers might not automatically get back pay under the 2019 law unless Congress includes specific language in the funding bill. So my question is, will you commit to making sure every furloughed worker from WIC to VOA and beyond is guaranteed full back pay once the shutdown ends? Yes or no?
Yeah, thank you so much for that, Lauren. Absolutely, workers should be eligible for back pay when the appropriations process continues in earnest, when the shutdown is over. Many workers, like those air traffic controllers and many others, are continuing their function during this shutdown, and absolutely they deserve back pay. And can I just make a little editorial comment here? The majority will often malign the work of federal workers, the so-called bureaucracy. These are the people that keep us safe, that provide vital services, that serve the American people. And I am tired of the tone and the tenor that attacks the work of the vital work of federal workers. So we stand with those workers. That's why we need to get this shutdown over. The back pay will be released. And I do want to also make note, the Constitution requires actually that congressional members receive pay during even a shutdown. I have told the payroll folks to withhold my pay while the shutdown occurs, and as along with those furloughed workers will receive back pay when this shutdown is over. To be clear, but I should not be getting payroll if furloughed workers are not as well. So just wanted to get that on the record. So Chris, do we have more callers, more comments and questions from the public?
We sure do. And before we get to the next one, I want to remind anyone on this call, if you would like to ask a question live, please press *3 on your telephone keypad right now. You'll be put in the queue to ask your question. And if you'd like to sign up for the Congressman's e-newsletter, press *6. Congressman, our next question is from Noah, who's watching online. It's a written question. Noah says, I am a federal civil servant, very concerned about how employees like me are being used, scapegoated, and gaslit, especially during this shutdown. For example, today's lies about back pay. How can Congress fight back against this?
I will take that comment. It's something that I agree with, and I spoke to that in my previous comments. Federal workers are being used as pawns in this shutdown and are being maligned unfairly. These folks provide essential services. Working for the federal government should be an attractive workplace opportunity. And the last thing these federal workers need are politicians using them and painting these workers in a negative light. So I appreciate that comment. Chris, let's go to another caller.
Congressman, before we get to the next question, I'd like to read that second poll question we have. And here it is.
Please do, because I certainly can't find it, and neither can my staff. So if you they're great. I love my staff. They are amazing. If without them, we would not be doing any live broadcast tonight. So God bless my staff. But if you have that second poll question, Chris, that'd be great.
Yes, sir. Here it is. Are you concerned about the government shutdown? If your answer is yes, press 1. If it's no, press 2. And if you're unsure, press 3. One more time. Are you concerned about the government shutdown? Press 1 for yes, press 2 for no, and press 3 if you're unsure. And before we get to those results and we allow some people some time to vote, I have another question for you from someone who's listening online, and it's Susan. Susan asks, are no King's marches helpful? What more can we do to oppose Trump?
Thank you for that. Susan, I believe was the name, Susan. Thank you for that.
Yes,
Absolutely. The No Kings protests matter. Mass mobilization of citizens matters to counter Trump's authoritarian style of government. I think, you have examples where the president is pushing for National Guard troops to go to Democrat-run cities unnecessarily, where there is not some so-called crime wave happening. You have scenarios where the president is acting like a strongman, acting like a king, a wannabe dictator. The way to counter that, and we're certainly pulling any lever we can in the Congress to oppose this president, but we need public opinion on our side. We need citizen action on our side. There are myriad ways to get involved politically and in local communities to have your voice heard. And I think the No Kings protest can be very effective, and it shows that the citizenry is not going to take this authoritarian government lying down, that citizens are going to be heard. I believe the people will be heard in the upcoming election cycle. So I wouldn't presume to suggest precisely how to get involved, but certainly No Kings, Indivisible Mid-Peninsula, Indivisible San Mateo are incredible groups doing grassroots action here on the peninsula. And there are myriad other groups that you can access online by doing a little bit of research. You can always call our office. We have to be somewhat careful to make sure that we are not providing a political a channel through this office. This is my official congressional office, not a political office. So there are some, we have to be very careful about the kinds of information that we provide. But I know that citizen action is absolutely necessary given the challenges that we are facing at the federal level. So, Chris, let's go ahead and get the poll results. I'm predicting another strong majority for yes in terms of people's concern, rightfully, about the impacts of an ongoing federal government shutdown. But Chris, what are the poll results as of the moment?
Well, Congressman, we got a lot of votes, so I'd like to thank everyone for participating. We asked you, are you concerned about the government shutdown? 92% of you said yes. 5% of you said no, and 3% were unsure.
All right.
Congressman,
Thank
I
you
have
for
another
that,
question
Chris.
for you. I have another question for you from someone watching online. It's Linda. Linda's watching this online, and she wants to know, what's the strategy to force Trump to halt National Guard in blue states?
Well, you saw a federal district judge issue a stay with regard to the troops being sent, potentially sent to Portland. You're going to see action in the courts on this that make it abundantly clear that the president is in violation of the 10th Amendment. Anything not specifically designated as federal, the activities of the federal government, those powers are devolved to states and localities. You have situations where the governors of the various blue states have not asked for National Guard help, and the president is overriding this. I mean, clearly, this is not about addressing crime. This is about, I would argue, the president wanting to normalize the visuals of troops in the streets. This is a president who will look for any opportunity to declare martial law. Sounds like a dramatic statement. It's what I believe. I think he is wanting to normalize the visuals of sending troops into cities and not suggesting for a second that crime doesn't exist, but using crime as a pretense to send National Guard troops into cities, using the military against our own citizens is offensive. It's a misuse. It's abuse of the troops. It is for purely political purposes, and Stephen Miller's agenda and Project 2025. And that is where the citizens of this country on the local level have to stand up. We have governors speaking out. We have law groups, legal firms bringing suits. My party, through political means, is supporting the various acts in our judicial lawsuits and so forth in our courts. So this is an all hands on deck moment for this country. But it starts with the citizenry stepping up and being heard. And then elected Democrats need to do whatever we can to bring balance to government in Washington, to be a check on this president. So, Chris, let's go to another caller.
Thank you, Congressman. We have another live caller coming up. We have Martha on the line. Martha, you are live. Martha's in San Mateo. What's your question?
Oh, I don't actually have a question. I just have a statement in that I admire the heartfelt efforts that you, Kevin, and Jessica perform, and it's possibly even a thankless situation to some degree, but it is brave and extraordinary, and thank you.
Thank you so much for that comment, Martha. I'm inclined to end on that, since it was so kind. But let's if we can, we've got time for another call, maybe, if we have a caller on the line. Chris, do we have one?
We're queuing one up right now. While we do, I'd like to remind everyone to sign up for the Congressman's e-newsletter by pressing *6. And right now I'm waiting for a caller to be queued up. Here we go. We have an online question. Question is, can you support the ballot question on redistricting?
It's a great question, and I hesitate to speak to this because it is a pending political item. I'm actually getting a little direction from my staff if I could speak to it. I think I could speak in general terms. I have to be very careful. I'm in my official office, so I can't speak directly in terms of my advocacy. But Prop 50 is on the ballot in this November. Ballots are going out. It's the Democratic response, essentially, to redistricting that's happening in Texas, where the president asked that the legislature, the Republican-led legislature in Texas, redraw the maps to add Republican seats. There was a move by Governor Newsom to counter that by having a mid-decade redistricting process unfold, where the voters of California will actually be voting on a set of maps redrawn, essentially, to help ensure more Democratic control in California in terms of congressional seats. It was done really in response to what occurred in Texas. The one note I would make, it preserves the independent redistricting commission, the Citizens Commission, which I fully support in an ongoing way. So when the 2030 census occurs and the reapportionment process unfolds for the 2032 election, it will be the Citizens Commission that draws the district maps. So this is very much, I think it's fair to say, a break glass in case of emergency moment when it comes to democracy. So that is what is being voted on. It remains to be seen if the voters will go along with the governor's proposal. It's essentially the governor's proposal. And we will see what happens. And I try to be as careful as possible not to use this platform to campaign on Proposition 50. And I'm being told we're going to go to the last question. So, Chris, do we actually have somebody in the queue for our last question?
We have a last online question. Cindy is listening online. And Cindy wants to know, how can we help you restore wholesome government?
Can you say that one more time, Chris? You just cut out just that last sentence there. Yeah.
You got it. Cindy wants to know, how can we help you restore wholesome government?
Wholesome government. Well, thank you for that. I think it's fair to say that this country has come through some dark places in our history. Civil War, the assassinations in the 60s, the turbulence, political divisions. I would say we are going through a very dark time in this country with a political dysfunction. I'm just struck by, I was looking at a clip of Bill Clinton when he was actually running for re-election, and he was talking about the shared values, regardless of political differences, that we ought to do whatever we can to bring people together. He didn't use these phrases, it's my phrase, but politics of the common good. Try to unify instead of divide. Sadly, we have a president who not only doesn't speak to that sense of shared values and working across party lines and bringing people together, but he seeks to divide for political purposes. And it is sad. We are going through a difficult time in our politics. I do believe we are going to come through this. I'm going to remain hopeful and optimistic that the people will be heard, even with the dark time we are going through, where immigrants get out of bed and live in fear. There are deeply, deeply troubling things happening right now. But I do know that this country has come through dark times before, and that there will be a post-Trump America that we can rebuild, where we rebuild faith in institutions that have been undermined by this president. We will make it to that post-Trump America. It starts with bringing some balance to government and being a check on this authoritarian president. It's about my party winning some elections and bringing a balance to the equation. And I think the path to wholesome government is in bringing people together with a politics of the common good that addresses challenges. Right now, with the dysfunction we have, it's very difficult to address some of the really big challenges this country does have. And it's going to take people of goodwill, regardless of their political philosophy. So I'm going to remain optimistic that we can get to that point. So thank you so much for that comment. And I want to thank all of you for taking the time this evening to be with us. That's all the time that we have. I want to thank Chris, our moderator, and my staff, of course, for making this possible, and Jessica Altman for being with me. As I've said during my other town halls, our democracy truly depends on all of us participating. I promise I will continue working tirelessly on behalf of you all and doing everything in my power to uphold the democratic values we hold deeply and to uphold the Constitution and the rule of law. If you'd like to sign up for my newsletter or contact my office, please visit my website, kevinmullin.house.gov. And with that, thank you and have a good evening.
Real quickly, I'd like to echo the Congressman and say thanks to everyone who joined today's telephone town hall. If you would like to stay up to date on the Congressman's work, please follow him on Facebook at Congressman Kevin Mullin, on X, Instagram, and YouTube at Rep. Kevin Mullin, and on Blue Sky at kevinmullin.house.gov. And if you would like to subscribe to his e-newsletter, just stay on the line right now and leave your name and your email address after the tone. Thank you all again, and have a great rest of your evening.